Hi, I'm Dr. Dutta. I'm a cosmetic surgeon at the Aesthetic Beauty Center. Traditionally, hair removal were done with waxing, plucking, shaving, and various chemical means, and those means are still available. However, lasers give a slightly different solution because it gives certain level of permanency. In the good old days, only ladies were worried, but nowadays we are seeing more and more men coming forward to have laser hair removal. It is done with 2 or 3 types of lasers or intense pulse light, and once that hair is destroyed, that follicle doesn't grow back. But most people will need a few sessions over the next few months or a couple of years, and then they can see the improvement. We nowadays call it a permanent hair reduction rather permanent hair removal. Laser hair removal needs a few sessions, as I explained earlier. The sessions are given between 4 to 6 weeks apart, and most patients will need anything between 8 to 12 sessions to get rid of the bulk of the hair. In the skin, if you can look at the model here, the hair follicles are pretty deep, so the skin at the top is not as thick. Probably on the face, the skin is about 1 millimeter thick, but the hair follicles go down pretty deep, between 3 and 4 millimeters, so the laser has to go deep inside the skin to destroy that follicle. We need to take into account what is the color of the skin, what is the color of the hair, and accordingly give a slightly different measure of laser, and also we can change the wavelength to suit the patient and the patient's needs to give the best possible outcome. Like all other treatments with laser, in itself laser is light, a special type of light, but it has also got the capacity to produce heat when the target, which is in this case the hair, is reached. And that heat can cause various damage like burns, bruising. If the burn is so deep that it can cause scarring, it also can cause slight increase in hair growth in the surrounding area. In experienced hands, if the doctor or the nurse who is appropriately trained and has been experienced in using that particular laser, these side effects are far and few between. And also we need to explain to the patient that when they're having the treatment, they cannot have any form of skin color like suntan or even the artificial colors that people use nowadays to tan their skin. We need the skin as clean and as normal or natural as possible to reduce the side effects. When we first started using lasers for hair removal about 15 or 18 years ago, we used to advertise it as permanent hair removal. But gradually, as our experience built up, we found that the hairs that are destroyed by the laser, they will never grow back because they are destroyed from the follicle up. However, in the skin, in various parts of the body, say for example in the scalp or the face, per square centimeter we have anything between 300 to 500 follicles. So body has immense capacity to push these hairs forward once the existing hairs are killed off. So in a way, it is permanent because the hairs that we are destroying will never come back, but skin will have capacity to bring forth these follicles that are lying dormant in the skin, shall we say. Initially, we started using 1 or 2 types of lasers, particularly the ruby and the alexandrite, but nowadays there are various types of lasers available. They are suited to individual skin color and also takes into account how thick or thin the individual hairs are. one thing for certain, the hardest hair to treat is the white or the grey hair. But taking everything into account, individual patients suit individual lasers. So the most common lasers are still Alexandrite, IPL and the Nd:YAG. And at the Aesthetic Beauty Center, we've got the full range of lasers to suit individual patients' needs and reduce the side effect profile to give a better outcome.